Dr. Corbin Pominville here from Better Life Physical Therapy and Wellness, Palm Beach Gardens. We're going to talk about how to fix chronic pain permanently. So we have something that we call the Pain Relief Acceleration Formula that we have found that is very, very effective for chronic pain specifically. So something that's been around for 2 to 3 months or longer. This is for you. Okay, path to a pain-free life. Basically, we took about 5 years to develop this formula. Lots of clients have been healed, and this is complex people with chronic pain. And it works about 5 times faster than traditional healthcare, and it works permanently. And here are some of the people we have treated with this formula. The downside of short-term pain relief. Basically, many treatments are temporary. Things like pills, injections, surgeries, manipulations, usually. Things like this are temporary. They do not fully fix you. They make it so you have to keep going back. In order to fix you, we need to target everything from a complex view, right? There's multiple things that go into fixing someone with chronic pain, and that's what we're going to talk about. So our comprehensive approach, basically, number one, full eval. We're looking at walk-in, we're looking at posture, we're looking at sports mechanics, we're looking at everything that's important to you and what you do normally. Number two, deep myofascial release. So this is deep pressure on connective tissue and muscles. Very, very effective for chronic pain. Number three, we need to turn the muscles on, so that means connect the brain to the muscles, turn them on, get them working. Number four, now we need to use those muscles in our posture and in our sports mechanics, right? So many times people strengthen muscles, but they don't bring that strength into the things that they're doing throughout the day or the sports that they're playing. And so you're really kind of missing the boat there. So the eval, the deep tissue work, and then turning on the muscles and then using them as we sit, stand, walk, and exercise. Very effective. So everything you need under one roof. So you don't need to go see multiple people. This is the formula, and it really works. So, and that's all there is to say about it, basically. Power of a whole body approach. Basically, symptom-based treatments are just a fraction of success, right? You might go and get something done, and maybe it lasts for a few months, or it brings down the inflammation slightly, or fixes you for a couple days, but it doesn't fix you long-term. This is the problem with most treatments in healthcare today. If you do the full body approach, it leads to lasting results. You're not alone in this. Many people, they don't know where to start. They're trying short-term fixes. They're feeling hopeless. They're feeling restricted from doing the active things that they want to do and wondering if they'll ever get better. This is a lot of people in chronic pain. So the formula. Will it work for you, and how does it work? Well, it's based on 3 core methods. So you got the evaluation, and then we get in there deep, and we release the stiffness and the tightness, which then brings your symptoms down. And then we have to fix the compensations of your posture or maybe your movement mechanics during, let's say, whatever you do for a sport. Or just simply walking or standing or sitting and making sure everything is working properly. If we don't do all of these things, it does not last long term. So number one, comprehensive evaluation. So we're listening to your whole story. We're looking at how you walk. We're looking at your sports mechanics. We're looking at your posture, your strength, the mobility of your connective tissue. That's oftentimes missed. Number two, we're getting in there deep, and we are releasing the tightness and stiffness, and helps address this in order to get your body to be able to be in the right position. More mobility, less pain from this. Now that you're able to be in the right position because you don't have so much stiffness or tightness, now we can actually look at fixing the compensations that your body's developed. So this could be postural, this could be movement patterns, and it has to be customized to you. So you may have different types of incorrect posture or movement patterns, and we need to make sure that we're addressing it for you specifically. So no cookie cutter approach here. So this is what it could look like, and this is what it's looked like for many, many people. Getting out of bed without pain, playing your sports with friends without limitations, living an active and healthy life. I encourage you to book a call and talk to our front desk, or come on in, get an evaluation. And basically what happens during that is we work on you, check you out, and then see what's missing, what's off posturally, and what's compensating, and then give you an answer on what we think it is. So you can either go to our website or give us a call and get in here for a consult. So betterlifephysicaltherapy.com, or you can call this number right here. We'd be happy to help. If you're not already booked in, come on in. We'll check you out and get you toward living a pain-free life. Thanks so much. Dr. Corbin Pominville, Better Life Physical Therapy, Palm Beach Gardens.